Hey guys, Jeff Lewis from Lewis Physical Therapy here. I want to talk to you guys today about one of the more common questions I get asked by pitchers or their parents after suffering some type of arm injury or surgery, and that is when can I get back to throwing, followed by when can I get back to pitching in games. And that is a multifactorial question where there are a lot of different factors that go into that. It is never a clear cut and dry answer. So I want to go over with you guys today some of the factors that we take into consideration. So first things first is the type of injury that we're dealing with. A pitcher that is currently coming back from Tommy John surgery is not going to be nearly getting back to throwing as quickly as a pitcher dealing with a low-grade forearm flexor strain. For Tommy John surgery, I've seen guys start throwing as early as 4 months after surgery. I've seen it as long as 6 months. 5 months seems to be the kind of sweet spot right now, and that's usually what I have found works best for some pitchers. But again, the longer that you take is never a bad thing. It doesn't necessarily extend your rehab timeline as long as there's no other setbacks along the way. It just more so gives you more time to prepare before you get throwing. So let's just say we have a pitcher that is getting ready to throw at 5 months after Tommy John. When we get to that 3-month mark, that's when we're really starting to look at getting in the weight room. We're getting just them loading in different patterns. So landmine presses, chest presses, different rowing patterns, horizontal and vertical rowing patterns, pulling patterns. And if we start when we start that at 3 months, we now have months 3 to 4 up to 5, so 2 months of good hard work in the weight room to just work on getting them stronger, getting them more confident in their arm strength, stability, and endurance. The other side of that is at the 4-month mark, we are going to start a upper body plyometric progression. So they should have at least, and I say at least very strongly, it could be even more than that, just depends on the pitcher. But after Tommy John surgery, they should have at least 1 month of a plyometric progression before they start throwing. And the whole goal of this is to better prepare not only their arm, but their body for returning to throwing through medicine and plyo ball, two-handed and one-handed drills. Now, when we're talking about timeline here, a lot of that also, especially in the case of surgery, is dependent on physician clearance to get ready back to throwing. So we work very closely with physicians that the physicians that our athletes have to make sure that everyone is on the same page of, hey, we feel comfortable returning this athlete to play. So the timeline is spoken about. Now we're going to move more into the clinical examination side of things, starting with range of motion. If we're dealing with Tommy John, we need to make sure we have full and painless elbow range of motion, extension and flexion early on in the process. This isn't something we're worried about. We're worried about getting like a week or even a month before they get back to throwing after Tommy John. We want to get that back as quickly as possible. When we're looking at shoulder, so guys that get labral surgeries, labral repairs, we want to look at the total range of motion throughout their shoulder, taking into account internal and external together, comparing to the other side, along with overhead flexion, cross-body adduction, but specifically, and especially when we're talking about labrums, we want to make sure they can get full external rotation for the shoulder back. So that's range of motion. Moving on to the strength side. We've talked about before how we want to make sure that an athlete is properly exposed to higher loads and stresses in the weight room environment before they get to throwing. If by the time an athlete is ready to throw, now again, this is different for youth athletes who are not going to load up the barbell and have them go crazy with lifting, but in general, for your higher level competitive athlete, if all they've been exposed to in their rehab is some light TheraBand, 3 to 5 pound dumbbells, we are really rolling the dice with them being able to handle these stresses that are associated with throwing on the arm and being able to have them safely continue throwing. So that's where getting in the weight room is so important, especially after surgery, to build that base level of strength. We've talked about the upper body plyometric side of things. One last thing I want to touch on for strength is rotator cuff strength specifically. And this is for whether it is a shoulder or an elbow injury. I mean, really, honestly, any injury where a guy has been down for a long period of time. It could be even an ACL surgery where they haven't thrown for 6 months, but we still want to make sure that their arm is in a good position to get back to throwing. And again, they're likely not going to be non-throwing for 6 months after ACL. That's more just for the context of this video. Regardless, whatever the injury is, if they're not throwing for a period of time, we need to make sure their arm is ready, specifically their rotator cuff is ready to withstand the forces of throwing when they get back into it. So For rotator cuff, external and internal rotation strength. So that is the ratio of their external rotation strength going back to internal rotation. Naturally, internal rotation is going to be a lot stronger for guys. There's a lot bigger musculature, more powerful movers that are internal rotators compared to the smaller external rotators. So when we look at the ratio in terms of getting ready to start throwing, I like to look for a ratio around the 67 to 75%. That's at a minimum to get started to throw. Some guys are not going to be able to reach that, 100% asymmetry or that one-to-one asymmetry. So we want to be realistic of, hey, what's a baseline value that guys are comfortable at for a shoulder strength to start throwing. So we're not going to just say, hey, you're at 70%. We're just going to kind of let you keep throwing. We're not going to do any more rotator cuff work. No, that is absolutely not going to happen. We want to make sure that they're staying on top of their external rotation strength, because that can easily be lost as a guy gets throwing. So that's where making sure that if you're getting back to throwing and pitching after an arm injury, you need to be somewhere where they're going to objectively measure your rotator cuff strength. Here at Lewis Physical Therapy, we use a handheld dynamometer where we assess guys in that 90-90 throwing specific position to get an idea at baseline what is their external rotation, internal rotation strength ratio, and then we will follow it. We will follow it throughout that rehab process. Some guys have more of a frequent assessment than others, but again, we just want to make sure that they are not losing strength throughout that process. So, taking all that into consideration, in summary, how do we know when someone's ready to throw? We need range of motion. We need good strength. We need stability throughout that joint, teaching those muscles how to support the joint throughout that entire throwing motion. And then we need to be exposed to an upper body plyometric progression. And that first part that we touched on is injury, and overall timeline is going to be a big factor into that. So if there's any questions you guys have, if you're currently a pitcher dealing with an arm injury, whether it's surgery or just a low-grade muscle strain, and you're just not really sure if you're ready to get throwing, feel free to reach out to us or leave a comment below with any specific questions you have on your rehab process.